Okay, hi everyone. This is part 2 for our outpatient antibiotic therapy tutorial. So I'm going to pick a different test subject this time. So I've picked this patient here. And again, as long as it says C Schelt Hospital or SSH, and the encounter type is not historical or external results, we can use it. So I'm going to use this day surgery. I will hit OK. And I'll just assign myself here. So we do the same thing. We go in and order the OPAT power plan, outpatient antibiotic therapy. So this time, let's do 4 days of treatment. And again, we'll order here future outpatient, and then it'll start tomorrow morning. And you can see that you have 4 days there, and we'll hit OK. And then I'll just hit done just to get rid of the screen. So you can see here we have 4 days, 1, 2, 3, 4. So again, we're in the same power plan, and this time we don't want any of these pre-populated antibiotics. So we're just going to go up here to add to phase, and you can click on that and just go add order. I'll just zoom out. So this time we want daptomycin. So let's type in daptomycin, and I'll just tap on the first one. So obviously we want to order it for every single day. So I'll just do that and hit OK. And I don't necessarily need that sentence, so I'm just going to tap away from it and then hit OK and then hit done. So it'll bring me straight to the dosing. So you have two options. If you know the patient has an updated weight up here, we can just make Cerner calculate the weight. If you don't know the weight, if it's not pre-populated in there, then you'll have to get the patient weight and calculate it yourself. So in this case, this patient is 64 kilos, so we can just order 384 milligrams of daptomycin if we're doing a 6 milligram per kilogram weight-based dosing. So I can just do that, 384 milligrams. Or if this time I have the weight for me, and I'm pretty confident this patient was weighed recently, I can do the 6 milligrams per kilogram option right here. And then the screen should pop up. So this is just saying what dose do you want? We've auto-calculated it to 384 based on the patient's weight here, 64 kilos. So we can just hit apply dose, and it's thinking, and it's 384. So it basically does the same thing. So route of administration, we can just type in IV, and then frequency would be Q 24 hours. And you have to pick an indication for daptomycin, so I'll just pick anyone there. And then I'm just going to minimize this by hitting the teacup here. And then you'll notice that you have the daptomycin right here, and it'll say planned day 1, planned day 2, planned day 3, and so on. So that's ordered for all 4 days. So if you want to actually add anything else to this outpatient power plan, you can. So you can just go to add to phase again, and then add order, and say, I want this patient to have some potassium as well, because I just happened to notice on my EMR that they're a little low. So I only want them to have the 1 dose. So day 1, we'll just say on day 1 when they arrive, just give them some potassium. I'll hit done, and you'll see 20 millimoles PO once. You can adjust from there, and I'll minimize here. And you'll notice it only says planned on day 1. So they'll only have the order for the 1 day. You can add both days if you want, and it'll just keep populating. So that's bonus, I guess. So we can just scroll back up and you'll see it's just the other regular power plan that we talked about in the other video. And you can add blood work if you'd like here. Otherwise, you can just go orders for signature, and then you can review everything you've ordered. So we have our 1 day of potassium down here, we have our daptomycin, and we have all 4 days of the schedule right here. And then you can hit sign. And of course, we have to pick where we want it, which is down here, Seashell Hospital ACU. And then, unfortunately, we have to do this for every single day. So we'll just go through that. Seashell Hospital ACU, sign. And one more. I should have picked fewer days for my demo, but this is real life here. SSH, sign. And that's everything. So you'll see this is your power plan. We'll just refresh here and we'll see your power plan is right here. I've highlighted on the left, and you see everything that you've ordered here. Okay, and that's it. Bye for now.